He is a member of the White House Coronavirus Task Force. We've seen him on TV a lot these days. Dr. Adams, it's good to see you. Thank you for joining us. You know,
well, it's really good to be here, Gail, and I appreciate the segment you just played. We really want people to understand that it's about preparation but not panic, and that you can't build a toilet paper fortress that's going to keep coronavirus out.
you are so right about that, but people are a little freaked out. They're a little panicked. And it's not just the stores that are running low. We keep hearing stories about hospitals that may not be well equipped. What are you saying, or what are you doing to make sure that the hospitals have everything that they need?
Well, we have the National Strategic Stockpile that has been around for years, and that we're always keeping updated, keeping maintained, so that when states have specific shortages, we can respond to those. But we're also looking on the demand side. And we're having conversations with the American Hospital Association. American College of Surgeons put out a statement this weekend telling people that, look, talk to your doctor if you've got an elective surgery planned. Now's maybe not be the best time to have that elective procedure done, because it uses up personal protective equipment. It potentially brings in coronavirus cases into the hospital, and it taxes healthcare workers. So we're trying to lower the demand while also increasing the supply of critical materials and resources.
Doctor, the administration is putting out new guidance today. Can you give us any idea of where things might be headed?
Well, we are at a critical inflection point in this country. We have the same number of cases that Italy had 2 weeks ago. And so we've got a choice to make. Do we want to follow the trajectory of a South Korea, where they had aggressive mitigation measures and everyone really leaned into this issue? Or do we want to follow the trajectory of Italy, where we're seeing a rapid increase in cases and more deaths? And so the CDC put out guidelines just this morning saying that we should no longer have large gatherings of more than 50 people. We really are all in this together, and we want people to think about social isolation, social distancing, so that we can make sure that coronavirus isn't being spread in our communities.
Well, Doctor, you bring up a great point. I mean, is social distancing and social isolation as a recommendation enough, or do we need to get ahead of the Italy situation by federally mandating that bars, restaurants, and other leisure activities shut down until this passes?
Well, it's important to understand that a lot of that authority in the United States lies at the state and the local level, and I know this as someone who used to work for both a local health department and a state health department.
That is certainly true, but the federal government has a lot of leadership capability, and if it said so, it might be done. Right. It would give a lot of cover to local politicians. So federally, should there be a mandate?
I completely agree with you. Yeah. Completely agree with you, and that's why the CDC put out the guidance this morning. That's why the president declared an emergency last week, and that's why you saw the tweet from me this weekend saying hospital systems should pull down their elective cases when appropriate, when they consider appropriate.
Do the hospitals, Doctor, do the hospitals have enough supplies? Some of them are saying they're concerned. Are our hospitals ready for this?
Well, again, we are leaning into the stockpile. We're increasing purchases. We're working with companies like 3M to make sure we can make more masks available. And there will be issues that pop up across the country, and that's what the stockpile is for.
What about ventilators? Do they have enough ventilators?
Well, as of right now, we have enough ventilators. When you look at different modeling projections, there are scenarios where we potentially wouldn't have enough ventilators, but the way that you make sure you have enough ventilators is to decrease the number of people who need them by leaning into these aggressive mitigation measures that we're talking about.
Can we talk about people on the front lines? Just this morning in Washington State, a emergency room doctor is tested positive. He's now in critical condition. What is your message to the healthcare workers who are on the front lines?
Well, I so much appreciate you asking that. We need to take care of the people who take care of the people. And I really feel like this weekend at the press conference, when we announced our new testing strategy, that we've made a turning point on testing. And you'll see that we prioritized among the groups to be tested healthcare workers. We've got to make sure they're safe and that they feel safe. We've got to make sure they have the PPE they need. We've got to make sure we're not unnecessarily exposing them to potential coronavirus cases with elective procedures that could be delayed.
PPE, what's that?
Personal protective equipment, gloves, gowns, masks, the things that we know keep people safe from coronavirus.
All right.
All right, very good. Dr. Adams, we appreciate you being here. I hope you come back again soon.
Thank you. Coronavirus.gov or your State Department of Health website are great resources for people out there.
Thank you.
Thank you very much.